Hello and welcome to our Q&A with Ramona Mercer. My name is Caitlin and I will be facilitating the session today. First, I would like to thank you for being with us today, Dr. Mercer. Your experience and expertise in maternal and child health and subsequent research and theory development has been beneficial to both nurses and patients themselves. Maternal role attainment theory provides a framework for nurses to assist mothers in this transition. This is a complex process that involves the mother forming a bond with her infant, having the skills to care for the child, and feeling competent, confident, and satisfied in her identity as a mother. This leads to improvement in health of both the mother and the child. A most recent publication from Mercer shows interacting environments and their impact on becoming a mother. The most important concept being the interaction between the mother, father, and infant, surrounded by both environmental variables to maternal-infant characteristics. This model depicts the complex issues the nurse must consider in the interaction with the mother. I will now begin with a scenario and then we will follow up with questions. Blessing and Jose bring 3-day-old Wisdom into the jaundice clinic for a bilirubin test. You ask how everything is going and she immediately breaks down into tears. Blessing describes suffering from anxiety and depression since her early 30s. She tells you she is exhausted, the baby is feeding at the breast every 1 to 2 hours. She explains that culturally, breastfeeding is very important. The couple has many questions and uses a lot of comparison from their friends on social media. By the end of the appointment, you get back Wisdom's blood work and he can be discharged home with no need for any follow-up. This is a complex scenario and it's evident that this theory can act as a framework for the nurse involved in blessing Jose and Wisdom's care. We know that this involves active listening, role modeling, educating mom on baby's cues, giving positive feedback, and ensuring there's appropriate follow-up. However, what we would like to address are some of the issues in the scenario where we struggle to apply the theory or have questions about the theory. I will now read out the questions from my colleagues for you, Ramona, and we look forward to your responses. Judy says, I have read some recent studies that found that women with strong beliefs about the importance of breastfeeding to their maternal role are more likely to breastfeed longer, but that those who stop in the first few months are almost 4 times more likely to experience psychological distress. In the case scenario, it is evident that the mother is exhausted, has mental health issues, and believes breastfeeding is important. How do you balance mental health and breastfeeding when both impact maternal role attainment? Morgan asks, how do you provide culturally competent care that facilitates maternal role attainment? I ask this because in this scenario, Blessing brings up her culture in relation to breastfeeding, but how does the nurse discuss culture in relation to becoming a mother? Jenny says, I did not see technology or social media as part of the environment in your model. I ask about this because today almost everyone has access to the internet and social media. There is comparison, competition, misinformation, companies marketing and targeting the vulnerable, aka moms. Women aren't just looking up to their own moms anymore, they're looking at the Kardashians. How, as nurses, can we help families navigate this? Disha asks, in your recent article, you discussed changing the terminology maternal role attainment to becoming a mother to reflect the continued process. My question is regarding the lack of update to the stages of becoming a mother that continue to only cover the first year. In the case of Blessing and Jose and Wisdom, it's still in the early days, but what about in other settings? How can becoming a mother to a school-age child be examined, or to an adolescent? This last question is for myself. In a complex scenario such as this, many novice nurses would struggle to address all the issues due to rationing of nursing care, meaning shorter appointment times. Even if they could mentally apply this theory to practice, they may only be able to assist mom with the tasks of becoming a mother, such as teaching her to feed the baby, and not address some of the underlying issues such as her mental health. Not only would this impact the mother's transition, but also lead to ethical distress in the nurse. How can we as nurses deal with balancing theory and practice in this complex healthcare system? Thank you all for coming to this session today, and a special thanks again to Ramona Mercer.